Thank you, Madam Chairperson. Distinguished ministers, dear colleagues, let me start my intervention by saying some historical remarks. During the last century, Bulgaria achieved commendable success in controlling the tuberculosis in the country by introducing comprehensive national programs and international best practices, especially by the end of the century, where in the year 1990, the TB incidence rate was 25 per 100,000 inhabitants. Unfortunately, some years later, due to a number of different reasons, mostly associated with the major socio-economic changes occurred in the country, the number of the registered TB cases doubled, reaching almost 50 per 100,000 inhabitants in the year 1998. And later, fortunately, this trend was followed by a slow reverse trend. And in the year 2006, the TB incidence rate dropped to 39, and in 2007 to 37 per 100,000. According to the latest official data, a total of 3,050 TB cases were notified in the year 2007. New pulmonary TB cases were 2,090, including 1,080 smear-positive TB cases, which is almost 14 per 100,000 of the population. And the case detection rate is 81%. Relapse cases were 105, retreatment cases because of failure were 28, because of default 44, and other retreatment patients were 132. There were 653 cases with extrapulmonary tuberculosis reported. In 2006, the treatment success rate for the cohort of new registered pulmonary smear-positive patients is about 80%. The proportion of default cases still remains high. It's about 6%. At the same time, there's an increase of a number of the MDR-TB patients, and according to the latest data in 2007, the notified MDR-TB patients were 82. The MDR-TB cases among the 883 new culture-positive TB patients who received DST, drug susceptibility test, were 36, which is around 4%. Notified MDR-TB cases among 121 retreatment patients who received DST tests were 46, which is almost 38%. So, and according to the WHO, in 2007, the proportion of MDR-TB cases in Bulgaria is 9.4% of all new TB cases and 37% from the previously treated TB cases. So what have we done in order to overcome this unpleasant situation? First of all, I would like to say that the government of Bulgaria fully recognized the importance of a comprehensive national policy to control tuberculosis. In the year 2003, we introduced the WHO recommended strategy for directly observed treatment of tuberculosis short course and its main principles. In 2007, the government adopted a national program for prevention and control of tuberculosis in Bulgaria for a period of 2007 to 2011. The program was designed to contribute the targets set in WHO Stop TB strategy, the global plan to stop TB, the Millennium Development Goals, and the Stop TB partnerships to be achieved. In the same time, the program reflects some particular changes in the health system in our country. The overall goal of the program is to reduce the burden of tuberculosis in Bulgaria. MDR-TB prevention and control was put for the first time as a specific service delivery area in this program. In 2008, the second national report, Millennium Development Goals, Bulgaria 2008, was released, and the report played a special role revising three major targets for the TB in our country. First one, to reduce the TB incidence from 39 to 22 per 100,000 inhabitants in 2015, to increase the number of successfully DOTS-treated TB patients from 80 to 85% in the same year, 2015, and to ensure complete nationwide coverage and high-quality application of DOTS. The report actually adapts the UN Millennium Development Goals to the Bulgarian context and revises the indicators for measuring the results. In the year 2008, another very important document of the government was developed and in December last year adopted. And the main goal of this national health strategy is to ensure better health and improve life expectancy, applying the principles of accessibility, equity, equality, and solidarity with, of course, the active participation of all stakeholders. The National Health Strategy aims also to integrate the health policies in all policies in the field, in our country, connecting health with internal affairs, national security, financial, social, labor policy, environment protection, education and sciences, transport, regional development, and rural policy. The National TB Program is an important element of this strategy. And to react to the recent developments with the M and XDR-TB, in our country we established a plan which to address the challenges and to set some national targets. The plan foresees a lot of activities and measures, and some of them are connected with development of national guidelines for MDR-TB, prevention and control, in line with the WHO guidelines, to establish quality-assured drug susceptibility test, and which to be available for all cases with positive culture. And as a part of the National TB Monitoring and Evaluation System, it is foreseen that a drug resistance survey should be performed in our country, supervised by the WHO reference laboratory in Italy, which to assure regular drug resistance surveillance in the country. And to ensure timely detection and appropriate treatment of drug-resistant cases, rapid molecular testing of the resistance against hydroniazid, rifampicin, fluorescent microscopy, and second-line drug susceptibility test will be available for the national reference laboratory and the third-level laboratories in the country. Healthcare workers in the laboratories and MDR-TB units will be regularly examined with annual interferon gamma assays to monitor the latent TB infection. And another very important element is that the plan foresees an establishment of regional networks, which to include the regional DOT managers, community nurses, the general practitioners, and the NGOs dedicated to work with the vulnerable groups in our country. This will increase the number of TB cases with early diagnosis and directly observed treatment, and will decrease, hopefully, the proportion of defaulters. And in September 2008, the Ministry of Health successfully applied to the Greenland Committee, and we expect that in the middle of this year, 2009, we will have the first 50 patients enrolled on DOT Plus treatment. Let me finishing by saying only that funding of the TB all the anti-TB activities in our country are funded by the government. The funding allocated through the Ministry of Health budgets, and in order to assure universal access to TB treatment of all the patients, to introduce immunoprophylaxis, early detection, diagnosis, treatment, and hemoprophylaxis, we provide all these services for free for all our citizens. And for a 5-year period of the national program, we will spend about 43 million euros, which includes, of course, some additional funding by the Global Fund. And the last sentence I would like to say is that we fully fully support the declaration that we will adopt on this high-ranking conference, and I wish a lot of success of all of us running on the field of TB and the fight against TB. Thank you very much.
Over to you, sir.